Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning to all of you. Last time we were discussing about the various lumps felt in the breast. Here I would like to discuss about two important lumps which most of the patients come to me. One being the breast abscess due to lactation, that is during feeding the baby, and also the axillary lumps. Let's talk about the breast abscess, which happens during lactation, that is while feeding the baby. If the breast is engorged, that means congested with milk, and the baby is not fed properly, then the breast tends to accumulate the collected excess milk in its pockets, and if left without expressing the milk, then what happens is the pockets of milk which is left behind and which gets congested, gets infected and forms abscess, which gives a lot of pain and unbearable to the mother, that they are not able to feed the baby, and it becomes a vicious cycle, and it becomes more and more engorged because of the collection of the pus beneath the skin, and it's very painful. It's so painful that they are unbearable, and they come to us seeking for help. So this can be prevented by feeding the baby very regularly in intervals of 2 to 2.5 hours. And if the baby has finished the feed and still you feel the breast is engorged or it's full, and it's better to express the excess milk away rather than allowing it to get collected, and this can cause a lot of harm. So in this condition is called the breast abscess during lactation, which needs to be drained if left alone without seeking help or removing the excess milk. So another common complaint where many young girls and many women come to me is they notice a lump in the axilla. Axilla means the underarms. They feel that they have noticed this lump, or it's always been there, or it's little feel that there is excess flesh or something. They come to us. So this is called axillary lumps, which are noticed because of excess adipose tissue. Adipose tissue means excess fat. If there is excess fat accumulation there, it looks like lumps. It is actually not a tumor, or it's not a growth which is happening. It is because of the excessive fat collected in the underarms, which is called axillary adipose tissue, which is noticed as a lump on you can have it on both sides, or you can have it on one side. Sometimes lumps in the axilla is noticed just before periods, or during feeding the baby, that is during lactation. This is because of axillary breast tissue. That means the breast tissue is also seen, a little amount is seen in the axillary area, where it reacts to the milk. When the milk is produced, it also collects in that area of the breast tissue, which is there in the armpits. So this is called axillary mammary glands. Okay, so this is noticed. It plays a role during the hormonal changes. If you're not married, then you will notice maybe a little pain and tenderness during menstrual cycle. So this is another common thing which patients come to me. And another lump can be because of inflamed lymph nodes. When there is any infection within you in and around the area of the breast, the lymph nodes can get inflamed and tender. So this also can be noticed. It can be because of benign reason, or it can be in early stages of malignancy. The first thing to be noticed is lymph node enlargements. So please don't get paranoid if you notice anything, because generally when we were students, we used to get so scared whenever we study about some subject, like supposing it is about a prolapse uterus. I remember that we used to psych ourselves thinking that, oh, I am having all what I have studied that day, whatever was discussed in the class. We used to go back in the room and imagine that we have such things. So please do not get paranoid or worried if you notice any such lumps. Please go and report to your doctor. I'm sure your gynecologist will relax you and make you understand what is the cause behind this.